Hello, Miss Kanisha. Let me just check your wristband. I'm Nicole and I'll be your caregiver today. I'm just going to put on a knee-high stocking just to help with your circulation. Is that okay? Okay, so I'm just going to put the bed up to waist level to protect my back. Okay. Again, always make sure you protect your back when you're doing any kind of procedure. Okay, so now I'm going to go ahead and walk around the other side of your bed and give you a little bit of privacy. Okay, I'm going to just go wash my hands and get the stocking and I'll be right back. So I'm coming to wash my hands, simulated for state. Grab the stocking and go back in. I'm just going to place it here. And these stockings, you can actually find them in several different colors. There's white, there's black, the tannish color. I'm going to go ahead and take my watch off. So before I start the skill, I'm going to show you how to find the heel. And the white stocking is a little bit harder to see, but the heel is usually a little bit of a different texture than the original sock. So you want to put your hand through the leg. And you go down and you find the heel. And it's usually a different color, different texture, as I said. You want to take it and kind of push it in and pinch it between your fingers. Don't ball it up, just kind of pinch it between your fingers. And then you take the leg part of the stocking and you bring it back down. And as you pull it out, the heel should still be in your hand. And that's what it looks like. So when you put the stocking on the patient's foot, you aim the heel towards the heel of the patient's foot. You just kind of slide it on that way. So you'll leave it like that so you can see how it looks. I'm going to go ahead and expose her leg. Only expose the one leg that you're going to be dealing with. Everything else stays warm and covered. Okay, so you can open the stocking up wide so it gets on the foot. Don't scrunch, just open it wide and go ahead and slide up the foot. These are a little new, so sometimes when they're snug, they're a little harder to get on. But that's kind of the purpose of a stocking. So you're going to take it up so it gets just above the heel of the foot. You can kind of see that. And generally, if you were doing this for a real patient, they would not have a sock on. It would go right up against their bare skin. But for skills purposes, we're going to let our client here go ahead and keep her sock on. So you're going to gather it all up as much as you can and just take it up in one swoop. It needs to go just below the knee. So once you get all that up, you want to go back and go ahead and check and make sure the heel is in the correct spot. If it's not, you can go ahead and bring it down a little bit. And right here, in this little area right here, you can kind of, there's no skin there, so go ahead and kind of milk it down a little bit. And then you want the toe, be very gentle. You don't want to cause any skin tears, any blisters. So the heel needs to be directly in the center of the ball of the foot. So it needs to be in the center here, and needs to be in the center here. So you want to always check and make sure. Some stockings have a teardrop shaped heel, some have a square. This happens to have a square. So I'm going to show you that a little bit. Kind of right on the heel of her foot. Okay, I'm going to make sure the toe is in the center. So the bold print in your skills book says no twist or wrinkles. You want to make sure the heel is in the center and make sure the toe is in the center. Whether the toe is placed in the back or the front, this stocking is made with the toe in the front. And then we just leave it that way. For testing purposes, we're going to leave her pants leg up. I'm going to go ahead and cover her back up. Okay, a little toe space right there. You also want to make sure your patient is not exposed. No prolonged exposure. Whatever you need to do, you go ahead and complete your procedure and then cover your patient right back up. Okay, so now I'm going to go ahead and put your bed back down in the lowest position. I'm going to give you a call light. Here's your call light, Miss Felicia. I'm going to go ahead and remove your privacy. Walk back around the bed. Okay, Miss Kanisha, we are all finished here. Is there anything I can do for you before I leave? Okay, so I'm going to wash my hands, document the procedure. The skill is complete.